through the spectrum. I love working with families. I love working with adolescents, and I love working with adults, especially ages 18 to 35. Yeah, so that's a little bit about me, Raini.
Awesome. I love hearing this story. I know I've heard this a few times, but I just love it every time. I wanted to ask, because you are one of only a few really mental health occupational therapists. And was there anything through your journey of your uncle's, diagnosis and his therapy journey that you saw was missing?
Yes. So, as a mental health, only about 2% of OTs practice in mental health. I think a lot more OTs have become interested in mental health, especially after the pandemic, where people were really struggling. We were in isolation, anxiety, depression was skyrocketing. But when my uncle, after his accident, my dad's family had never experienced tragedy before. And it was really hard. Everybody had their own ways of coping, their own ways of communicating. And often when people are feeling anxious in the unknown, things come out in different ways. And I just noticed this gap in care where who was there for the family? And, as an OT, depending on what setting you work in, whether it be truly a mental health setting, or maybe you are an OT in acute care at ICU, being able to have strong psychosocial training in order to address some of those needs for the families, in addition to the needs of the individual who has experienced an accident or whatever it may be, is so important. And often, when a psychologist comes in or another mental health professional, they're providing therapy, it's usually one-on-one with that person, but rarely are there services available for the family. And I think because of that, I was so drawn to mental health. But, we all have mental health stuff in our families, which, makes us, eager and interested to learn more about it. Because I think when it comes to mental health, so often things seem very scary. And I always encourage students, dive into what scares you the most, because if you can dive in, it takes the fear away a little bit, and it can prepare you for what may come.
Yeah, absolutely. I like how you addressed the family aspect that one, healthcare plays a role in, but specifically OT, like it really is under our scope of practice to address family needs and family care just as much as that, particular patient. You said something and I wanted to not forget it later on, about the COVID and the mental health. I know you had the year before me, they did their photo voice presentations.
Yes.
And maybe we can lead into a little bit of research here, but do you want to talk a little bit about
how
you led that?
What Raini is referring to, for those of you listening and watching, when the COVID-19 pandemic happened, at Midwestern, we have a level, like the first rotation our students go on, where they get exposure to an occupational therapy setting. We used to do it in community mental health sites. And then COVID hit, and we didn't have access to those same sites. And at the time, I was in charge of the class, and I was scrambling for what are we going to do? And we decided to look at the therapist experience during the COVID-19 pandemic. So students were paired up with occupational therapists, occupational therapy assistants, physical therapists, PTAs, physical therapy assistants, and then speech and language pathologists and speech therapy assistants, or speech therapists. I always get confused. I apologize that I'm using the right names and credentials. But we looked at their experience during the COVID-19 pandemic and what it was like for them. And after doing that, it took us a couple of years, but we turned it into a research study that we have submitted for publication to look at, from a qualitative perspective, what was the lived experience for therapists during that time. And it was very interesting. And it was such a meaningful opportunity because students got to be a part of that. They helped with the data collection because it was part of a course. And it was also very meaningful for them, but it was also very meaningful for the therapists to be able to share their lived experience. Mm-hmm. During the COVID-19 pandemic, we heard about the first responders, we heard about physicians, we heard about nurses, but we never heard about physical therapists, occupational therapists, what was going on with them, how their lives were changed. And, for a lot of the OTs who were working with COVID-19 patients, people who had it, they were doing positioning. they were there at their end of life for people who had passed away. It was very hard. So the feedback that we got from our participants, that it was incredibly healing and cathartic to be able to be a part of this study. And it was really such an honor, I think, for us after to be able to have done that study and having had them be willing to participate.
Yeah, absolutely. I think that's so amazing. And with the whole COVID-19, everybody was praising all of these healthcare providers, but we really had no insight on the other end as to really what they were going through. So I think it's so awesome that you were able to conduct a whole research and the students were able to be a part of that. Because, yeah, I mean, even just hearing about it in classes, it really does bring a light to not only the mental health of the community, but also us as providers as well.
Yes,
Um,
and as providers, sorry, Grady, didn't mean to cut you out, but even as
no,
providers, for those of you who are watching who might be medical professionals or thinking about it, we are in a healing profession, right? We are there for people, but there's also this significant risk for burnout. And sometimes we are put in situations that can be traumatic, unbeknownst to us, but afterwards we start to feel the effects because we don't have that adrenaline rush. So it was an interesting thing to be able to do. Okay, Raini, you can go on. I
absolutely.
apologize.
No problem. Speaking kind of about healthcare providers and anxiety, more specifically student
Mhm.
healthcare providers and the anxiety, I wanted to personally ask because I'm about to start my fieldwork in about 6 weeks. And I know that there are some people who might be watching that are either applying to programs, looking into programs. What are some things you see in students regarding this anxiety, and how would you maybe tell somebody in my position or theirs what they can do?
Oh, yes. So there's always going to be anxiety with the unknown, that anticipatory anxiety of, am I going to make it? Am I going to be good enough? Am I going to know enough? And you will, right? There's a certain amount of anxiety that is helpful to help fuel preparation for experiences like rotations. But then we can teeter into perfectionism or even imposter syndrome, or we don't feel like we're good enough, or we're not sure what our value is. And I always encourage students to know, like, enough. Sometimes you just have to keep telling yourself that and being confident in what you know, and what you don't know, you'll ask questions, you can look up. Learning to be a person who is resourceful is one of the best things you can do when going out of rotation. You're not supposed to know everything, right? You are in training to be an entry level practitioner, especially with your level one. You're not expected to be an entry level practitioner. Ask questions, that's okay. Also, not that we don't really need to carry around books anymore, right? Because we have an encyclopedia in our pocket all the time. But, researching what you're curious about, if you don't know, trying to find the answers and then asking your fieldwork supervisor what their advice is, taking risks, right? Safe risks, depending on where you are at. But being comfortable that this is a learning opportunity. You are learning in your fieldwork rotation just as much as you are learning in the classroom. It's just a different type of learning.
Absolutely. Thank you. I appreciate that so much. Um, and now I wanted to ask, so I know personally that you work a lot with high functioning anxiety,
Mhm.
or at least you speak a lot about it on that I see on your Instagram page. What is high functioning anxiety for those that don't know?
Sure. So high functioning anxiety is not a condition that's in the DSM, but it's a widely recognized phenomenon. It's a widely recognized type of anxiety where it doesn't inhibit you from doing the things you want to do that you need to do, like you're out doing it. High functioning anxiety often coincides with high achieving people. So I see a lot of high functioning anxiety in graduate level students. And so often high functioning anxiety serves you well for a period of time. And then you might hit points in your life where being on edge all the time, perfectionistic tendencies no longer serve you well. Maybe they're getting in the way of completing tasks at your job, moving past errors, being able to reflect on your own failures. It might get in the way of relationships. That high functioning anxiety is important to be aware of because you can't always be in fight or flight, even if it's mild fight or flight forever. At some point, you're going to hit a point where it no longer serves you well. And being able to Recognize that is the first step. And then the second step is trying to figure out what is fueling the anxiety that a person is experiencing, whether it may be thoughts related to failure or perfectionism, whether it might be feelings of not being good enough, always comparing yourself to someone else, right? Whether, I mean, I see it in grad school where students are comparing themselves to other people. Where did they stand in the class rank? What did they get on an exam or an assignment? And they determine their worth based on those scores, which I just don't do that. Like, your worth is so much more than that. You are not your grades. You are not your scores. You are not your class rank. You have so much more value in this world. And I think it's a really hard thing to push through, especially in adolescence, right? And adolescence, and the way that some people label it, can go all the way up to like 34. But typically it's like 14, 13 to mid 20s or late 20s. But there is so much more to life that if people can start to determine their worth in other ways, that they're a good friend, that they're patient, that, all the other things, that can be so much more helpful. Other ways that people can combat high functioning anxiety and anxiety in general, if there's a different type that someone is experiencing, is, if you're feeling avoidant, push through the avoidance. Keep doing what you need to do. Engage in mindfulness practices, whether it's diaphragmatic breathing. So like 4 counts in, 8 counts out. It helps to stimulate something called the vagus nerve, which then turns on the parasympathetic nervous system and turns off the sympathetic. So we go from fight or flight to feeling more rest and digest, or calm, cool, and collected. You can also, daily affirmations, gratitude journaling. If you wake up in the morning and you find that you're someone that grabs your phone, change up that habit and that routine. You want to be someone where you're journaling in the morning, gratitude, writing your gratitudes out. Nature, if you can get outside and see sunlight within the first 30 minutes to an hour. I know that's harder in places, like I'm from Wisconsin. There's like 4 hours of sunlight every day in the winter, but being out in nature is so important. It optimizes your mental well-being, your mental health. I know a lot of grad students aren't going to like to hear this, but consider cutting out caffeine. Caffeine can fuel anxiety. It will never cause anxiety, but this, caffeine induces symptoms that are the same as anxiety. It increases heart rate. It can make you jittery, shaky. That people who are really sensitive to something called interoception, which is your internal body sense, it helps you determine if you're feeling nauseous, if you're cold, if you're have to use the bathroom. It's also tied to your emotions. So when you're hypersensitive to interoception and you're also someone that experiences anxiety, and then you add in caffeine and you start to notice, oh my gosh, I'm shaking, my heart's beating really fast, it can lead to increased anxiety. So reduce, coffee intake or caffeine, or just cut it out. It's going to change your life, I promise.
Yeah, I definitely noticed that, and I would have never been able to put that into words. So I'm so glad, because you really don't know, and then you're like, why am I feeling like this? But that makes total sense. I really like that you touched on how grad students can get this really like high functioning anxiety from all the things that we have to go through, and the comparisons, and the feelings of like, am I good enough? Did this grade ruin me, ruin my reputation, all of that. I really, really enjoy that Midwestern has been so supportive of us and been very adamant, like, your grades matter to a point, but they're not defining you. And as a student end of that, like, having professors that care about us beyond our grades is so, so important. So I really appreciate that. So how can an OT address some of these, maybe not just high functioning, but anxiety in general, and treatment sessions, or
So OTs can implement mindfulness. They can implement new habits and routines related to optimizing wellness through regulation. So looking at, from the time a person wakes up in the morning to the time they go to bed, what are they doing? What are they engaging in? What kinds of occupations? I always like to check how much screen time a person has, and then trying to find activities that they enjoy that can replace maybe some that aren't as adaptive or positive. So if they're engaging in social media a lot, Maybe it's going for a walk in the evenings, reading a book. Reading has so many mental health benefits that people often forget. And even, limiting your access to news or watching TV, because we're not in control of what we're exposed to. And sometimes you can be watching something and think you're watching one thing, and then all of a sudden something else pops on the screen that can be, stressful or traumatizing in nature. Other things that OTs can do is looking at implementing something called systematic desensitization. This can be really helpful for phobias or for, like a persistent incident. It's mainly for phobias, but I've utilized it with clients that have a really intense fear around like one thing. And it may not meet the phobia category, but is kind of teetering that way. Systematic desensitization is a type of intervention where you create a fear hierarchy around a particular type of situation. And then, you engage the client in the least fearful part of whatever it is you're looking at, and then you work upwards and you develop coping strategies along the way so that they can be successful as they are exposed to anxiety provoking situations or things, so that we know we can introduce them to something that's the least fearful and they can be successful working their way up to the thing that is the most fearful. Anxiety is a funny thing where it is fueled by fear. And the more that you fear something, or the more that you actively avoid something that is fearful, the more you're going to fuel the anxiety. So we really want to get clients going and, engaging in whatever it is that is scary for them. Exposure therapy, systemic desensitization is often like the gold standard of what we want people to be able to do. Anxiety too, when as an OT, I'm always thinking about, the end goal is to be able to inevitably expose enough that the brain rewires so these anxiety provoking situations or things or thoughts are not there as much, that, the brain is not running so much on fear, but becomes more resilient in nature and cultivating resilience. So as an OT, we're always thinking about how do we build mental wellness, well-being, and resilience, also while treating anxiety and helping a person engage in the things they need to do and want to do. Panic disorder is also a really unique one where people have reoccurring panic attacks. They often come out of nowhere. They can be terrifying for someone who's never had one before. People often end up in the emergency room thinking that they are having a heart attack or dying. It can be anything from, starting to experience tingling in the fingers, to heart palpitations, to a racing heart, to feelings of impending doom. And OTs can work with clients. They can incorporate systemic desensitization down the road if there's a particular thing that's causing it, like driving. I also love creating a panic pack with clients where we find sensory stimuli that are really calming for them, such as, essential oils, a lotion that feels good, smells good. Maybe they have a weighted lap pad in their bag. And then, oddly enough, too, noxious stimuli can really disrupt the neural pathways that are causing a panic attack, such as something sour. So I have clients that will pack warheads in their panic pack if they're starting to have a panic attack, because how the brain works too, it develops this negative association. And the idea is that if something noxious is there, they will also less likely have another panic attack with a noxious stimuli. But again, exposure is really important, and we need more OTs who specialize in mental health in general, but also anxiety, because it is by far one of the most common conditions, diagnoses that we see. I think the last statistic I said, which I'm guessing probably will go up, at 85% of people will experience significant anxiety at some point in their life. So if we can have more mental health professionals, especially OTs, who don't necessarily process out trauma or go deep into the past, but really focus on the present and the future of how do we support people to keep moving forward, to do the things they need to do. When you're a student in grad school, you need to go to class. You need to engage in your exams. You need to still be a daughter, a wife if you're married, or a mother. You need to be able to do all the things you need to do. And OTs are a unique profession that's equipped and highly educated to be able to support you, to help you engage in those things that matter to you.
Yeah, absolutely. I think also with anxiety, a lot of people may not understand what it is or what it could look like, because it's so commercialized as like, heavy breathing, shaking,
Yeah,
but it can be as simple as tingliness in your fingers and the
yeah,
shutting down.
yeah.
So it's so important to get people to recognize what that is, so that when they're experiencing it, they go and find what they need to help
Mhm.
get through that. And I really love that, you explained so articulately how OT's role really plays such a big part in mental health. And, we should be in those rooms with the other professions, because we provide something that can get you through that day. You leave the office, you have something in your toolbox, which is something I personally love about the profession. Um, and I know you kind of talked a little bit about your prior experience, but how did you land on like where you're at now with mental health OT?
Yeah. So jumping back, I started to get into trauma work when, oh gosh, I don't even remember. Maybe I was like 2 years out of practice, and I was working at a school for the deaf. And I started to notice a lot of the students had behaviors. And I think it was at the time 5% of the students who were going to school, 5% of their families could sign with them. So a lot of these kids were going back to families that could not communicate. They were living in a languageless environment. Just imagine what that does to someone. We need language to develop. We need language to develop emotion regulation skills, self-regulation skills, a sense of who we are, a sense of self-worth. And I started to realize that in a way, these students potentially were experiencing maybe some level of trauma at that point in time, is what I was thinking. And I became fascinated in mental health with that. We also had a fair amount of students that had trauma in their background. They had childhood trauma. And especially when we look at the ACEs, which the ACEs questionnaire is the Adverse Childhood Experience Questionnaire. And there is a really great study done by Folletti et al. It's still, I think, the largest epidemiological study to date on trauma. But it really that one looked at like, how does trauma, this is why trauma is more widely recognized now, but how is trauma related to negative health outcomes, not just mental health, but cancer, COPD, heart disease, all sorts of health ailments. And that's typically what most people are concerned with. So when we could tie trauma to that, there was a lot more funding opened up for that. Anywho, so trauma is a big deal. And when I was at day school for the deaf, this opportunity came about at Midwestern for a faculty opening. And at that time, I had not been out many years. Now that I think about it, I cannot believe that Dr. Brown even entertained this idea. But I emailed her and I was like, hey, I'm thinking about applying. Do you think you can show? She goes, go for it. And I'm like, I was like 3 years out of school. That was crazy. And she said, go for it. So I applied and I actually got an interview. I interviewed at Midwestern. I think it was the weekend, the Monday after I got married. That Saturday I got married, and then I had my interview, and I didn't get the job. Dr. Trujillo did, and he so deserved it. But then a couple of months later, Dr. Merchant had called and said that they had a small opening, which was a great way for me to get into academia. It was part-time. I could get my feet wet. I had tons of mentorship. And then because I couldn't work part-time at D School for the Deaf, I transitioned to Child Help, which is a child advocacy center. And that's where my love of mental health came from. I was mentored and worked very closely with Dr. Shafali Gandhi. She is in the clinical psych program. She's a professor there. Just doing a shout out for her. She is one of the most brilliant people I have ever worked with in my life. I feel so fortunate and blessed to know her, to have been mentored by her, but she changed my life. And also because she valued OT so much. At that center, we did a transdisciplinary approach versus interdisciplinary approach. So instead of us working collaboratively together between sessions, we were in every session together. So therapists may have been processing trauma, and I was there observing, looking for sensory opportunities for regulation. Every day I lived, ate and slept and breathed regulation, emotion regulation, self-regulation. It's like all I did. So jumping forward to Midwestern, that's where, my love for mental health came from. And I teach the mental health curriculum, but anxiety and trauma are very closely related. When someone is triggered by trauma, past trauma, they have an anxious response. It's just, surpasses, it doesn't go to the cortex. It's very amygdala based, meaning you're not really thinking about what's happening. It just happens due to previous experiences. So, I think, working with individuals with trauma, individuals with anxiety, perfectionism, that's my love. And then, right, working with grad students every single day, you can't help but fall in love with perfectionism because most of you got it. That's how you got to where you are, and then we're like, stop worrying about it. And you're like, but that's how I got here. So it's just I love being able to pair my clinical work and being able to bring it in and being an academic mentor, and then also still being able to practice a little bit clinically so that I can bring that lens into the classroom and help support my clients. Because I think when we can continuously engage with clients, we don't really lose our clinical edge,
Yeah, totally. I think this is a perfect transition, but I did want to touch on just how you were able to find mental health. That is so important for OTs that are going into settings that might not be directly related to mental health, just how prevalent it will be. And this is why we take classes on this. This is why you've come in and teach us all about it.
Yes.
So totally, like from a student side of it and now going to be starting my field work, I have such an appreciation for it. And, I just hope that others can recognize that as well. But you've done such a great job teaching us that. So I feel like we are definitely more equipped getting into that. So now you mentioned it, but I want to go a little bit deeper with what you do now. So you work as a professor here, but you work at a private therapy. Okay.
So I have a really small private practice. It's like in conjunction with a private group practice in Scottsdale. And I see very few clients, but I like keeping my foot in the clinical world. I primarily specialize in supporting teen girls and adult women, specifically 18 to 35 years of age, up to 40. So millennial women, Gen Z women. And I primarily work with anxiety. And I also really love working with anxious, high achieving women and girls and looking through an emotional intelligence lens when working with them. In O.T, there is more literature coming out on the value of emotional intelligence, but I still think there needs to be a lot more literature looking at how we can utilize emotional intelligence as an intervention to improve and foster mental well-being. Emotional intelligence is directly related to resilience. So resilience is our ability to take stress in, cope with it, and then bounce back. So if you're a highly emotionally intelligent person, you're probably going to be resilient. And if you're resilient, you probably have a fair amount of emotional intelligence. But I just love it because I think it gives us this really clear framework to work from. And it also can help pinpoint where people have where their weak areas are. So I use two different assessments clinically. If I'm working with someone who wants to work through their anxiety from an emotional intelligence lens, and I use the Mesquite or the EQI 2.0. I like the Mesquite better because it's ability-based and there's no bias with it. And then we look at, how do you perceive your emotions? How do you perceive the emotions of others? How does that relate to your anxiety? What is your emotional awareness like? Often people are either highly aware of their emotions too much or not aware enough. And sometimes we see a lot of avoidance with that one. It also goes in, how do we effectively use our emotions? How do we understand our emotions? And then how do we manage emotions? And that looks into, coping, stress management. And usually people, score at least high in one area, but there is at least one area where usually there's a little bit where they can improve, and that can kind of also help give me more information in relation to anxiety, how it's kind of impacting their everyday life. But I use a lot of traditional methods as well: systematic desensitization, mindfulness, acceptance and commitment therapy, CBT. It all depends on what my clients are needing. This is really fascinating, Raini, but I have a client that shared with me recently that we've been doing a lot of mindfulness with anxiety. And mindfulness also requires a lot of mental imaging, like visualization. And they had found this off of TikTok, of all places, but they said that they found this video where this woman had shared that she doesn't see mental images when she closes her eyes. If I said, close your eyes and see a blue triangle, they see nothing. And it's called aphantasia. And I thought, number one, that was so great to know and so insightful. But, knowing how our clients, how they process information is so important to their healing journey and how we work with them, because now I realize we can't do visualization together because it's going to do nothing for them. But we can still do some mindfulness exercises like mindful eating where they don't have to visualize. But I thought that was really interesting. And, I've been practicing for a long time and I'm still always learning. So this goes back to when you were saying advice for rotations and for students that are feeling anxious or have imposter syndrome. The more I know, the more I feel like I don't know, and I'm learning every single day. So don't ever feel like you don't know enough, because you do. You just got to be open to learning new things every day.
Thank you. Yeah, that is, who would have thought that because some people just aren't able to process those images, that you could be doing this and it really doesn't have as much of effect as other things could have. So that is really helpful to know. And who would have thought it would have related back to OT, but everything relates back to OT.
It can, right?
Yeah. So I wanted to get now into like the entrepreneurship of OT, because this is something that me and you have talked about privately. But how, like, what is, kind of just give the viewership, like, what is the space that is opening up for OTs to walk through and take these opportunities, now more, better than any time other before?
I think the best part about entrepreneurship and OT right now is the social media piece to it, which is the wild, wild west. I am not a social media lover because as someone in mental health, I realize how terrible social media can be for you. However, it's here and it's here to stay. And I think we need to embrace it. I think we need to set limits for ourselves. OTs who are a mental health practice, also helping your clients set limits for it. But social media allows you to have this free platform to be able to gain and develop a community, and you can provide free information, which really breaks down barriers for cost, for geographical location, and can make care more accessible. With that said, right, we're not providing medical advice or behavior therapy advice over social media because they are not our patients or clients. You can get into a lot of liability issues if you do that, but you can educate, you can share what you know, and then you can also for free put up your website in the link to help draw in customers. And what I think is so wonderful about it is you can start developing a business at no cost to you. You can try it out, kind of figure out what your niche is. OTs for the most part are historically have been much less likely to go into entrepreneurship compared to the other therapy professions. Part of it is our personalities are a little bit more go with the flow. We're not as, I want to be so careful how I say this. We just historically have not. But I think it is time that we really start to feel comfortable and start to push more into that entrepreneurial space, because OTs, we know a lot of information, especially when we niche down and have a specialty. And, you can do everything from, whether it is marketing through social media for a private practice, you can develop online courses. This summer, I'm playing with the idea. Now I'm going to say it out loud. So we'll see how this goes. If people have opinions about it. Playing with the idea of encouraging people to do their program development this year, Raini, doing online-based courses versus if it were in person. I think people would be much more likely to be able to pursue that because it's cost effective. If you're developing a business where you have a ton of overhead, you're going to need a lot of capital up front, a lot of money up front, and people are much less likely to do that. But if you were taught on how to navigate entrepreneurship in today's digital world, and it would cost you minimal money to get started, I think people would be much more likely to explore it in the future. And there's a big presence, especially in like traditional therapy. They're starting to kind of break down barriers on social media and market and help people kind of navigate that. And I think it's time that OT does it as well. And for you, Rainy,
Yeah.
I want to flip it now a little bit, but Rainy, for those of you who are watching, has a very unique population interest. I'm so excited for her. I know that she's going to do something amazing and she's going to dive
Thank
right
you.
into that entrepreneurial space. But do you want to share with people, what you're really passionate about?
Sure. And thank you so much. I really appreciate that. I think that just goes to show like at Midwestern, we have so much support. And specifically, Dr. Anderson has really been so supportive and helped me kind of guide through a process that didn't really have a set space in traditional curriculum. So, what she's referring to is I am very interested in sexual health and sexual satisfaction, specifically as it relates to OT. I have a fieldwork level 2 placement in a pelvic floor outpatient clinic. So I'm so excited to learn a little bit more hands-on how OT now has a role. But I'm interested beyond just the traditional pelvic floor space and also into the mental health side of it, the social, psychosocial factors that relate to sexual health beyond just our physical health. And yeah, I've been so, so grateful to know somebody like Dr. Anderson, but specifically Dr. Anderson, who has been able to kind of just encouraged me to kind of go through this because as a student, we're dealing with such imposter syndrome of, do I even know what I'm doing? Like, I've been here for the last 2 years and I've learned all these things and I have all this knowledge, but how does that relate into practice? And being able to be supported and be like, no, if this is your passion, this is how we can get there. And just having somebody that was able to back up and help me and a student or partner work on a whole systematic review research paper related to sexual satisfaction and relating that back to OT. I think I've learned so much with social media, even though I've not been on it as long. But what I've kind of started to realize is we have this voice to advocate for OT, but also just to get people more aware of maybe things that they've thought but they haven't been able to put into words, or needs that they have that they haven't identified. Because as OTs, we just want to help people. We're fixers. We want to find solutions. And so I think it's so, so great that through entrepreneurship and social media and just like having the world as our oyster as a student, we haven't been able to practice, that we're able to kind of dive in and see where it takes us. As a student, though, for anybody who might be listening, I encourage everybody to just take everything with an open mind. What you love and your passions will find you, and it's okay to go outside the curriculum to do research. So just because a professor doesn't bring up a topic does not mean you don't have the agency to learn about it and educate yourself on it. So I really would encourage people to take that in any profession. So whether it's OT school or becoming a lawyer or going to undergrad for your first year, I think it's so, so important. But thank
Yeah.
you so much. I really appreciate that.
Oh, I mean, Rainy, you're amazing. I mean, you are it. You just need, I think it's important for students to be able to come to professors, to mentors with an idea and know that they're going to be supported. And I think for those of you who are watching who might be applying to grad school, a piece of advice that I have for you, even if it's not Midwestern, when you are interviewing, when you are applying to schools, as much as you want to pay attention to where the school, how it's ranked, all the things that people pay attention to, the thing that is most important is, do you feel connected to the people at the university? Because I can promise you this, when you are close to graduation or when you graduate, those relationships are going to be what matters most. Those are the people that could connect you. Those are the people that are going to care about you. You want to make sure that you're not a number. You want to make sure that you are valued, that you are heard, that you are cared about. Just like in therapy, the number one predictor for patient outcomes is the rapport with the therapist, how the client feels when they're the therapist. The same goes for the classroom. A strong predictor of how successful students are is their connection to the professor. So you want to make sure that you feel connected in some way. That should be one of the most important things that you look at when you're choosing a school.
Absolutely. I would, yeah, ask questions. I think we forget when we're in the application process for a job or school that you're also seeing if this is a good fit for you. And I think a good place for you. We'll be able to answer questions that you have. Specifically here, like Dr. Anderson has spoke on, she has so much experience and she's a practitioner still. So she's constantly gaining experiences, keeping her foot in that. And it really does translate so well into the classroom because, you know, being able to lecture and give examples as a student is invaluable because then you're able to put the words on the screen into a life scenario that we may encounter in the future. So I definitely would back all that up. I wanted to see if we have some questions here.
Great.
So let me see, just so we don't have enough time. So we have a question about if this will be done at all programs for Midwestern. I'm not entirely sure, but this will be recorded and uploaded later on. So if you had to jump out, you'll be able to find this. Okay, perfect. I think that was, if there's any more that comes in, we'll address those. But yeah, thank you so much. I really, really appreciate as a student hearing all of your advice for us because it is so scary. And I wish that I was able to attend something like this as I was applying because I think it would have made me feel a little bit better. Okay, here's another question. What is the best interviewing tip in your opinion?
Oh, that is such a good question. Oh, but best interviewing tip. Okay, well, I have a couple of them. Number one, be yourself. Okay, show up as your authentic professional self. It's not about playing a game or saying what you think we want to hear. It's about answering the question honestly and authentically. If you get really nervous in interviews, it's completely appropriate to say, I'm excited to be here. I just want to let you know I'm feeling really nervous. So if you see me taking some big breaths, that might be what's going on. Sometimes that can also just ease the anxiety related to interviewing. But just be yourself, you know, find a point of connection with the people who are interviewing you. And also always keep this in the back of your mind. Just like Raini said, you are trying to figure out if we are as a good fit for you just as much as you're trying to figure out if we are a fit for you as much as we're trying to figure out if you're a fit for us. So if you can kind of tell yourself that, it can relieve any anxiety. You know, ask all the questions that you have. Don't feel like you can't. I know at least for the OT program, you get an opportunity to talk with, you know, two of us who are interviewing you. You also get an opportunity, I think, to talk to either the program director or Dr. Schofield, and then also with the students. So, you know, write down your questions so that you get everything answered so that when you are making choices, because we are well aware that most of you have a lot of choices, that you feel like you are making the best choice for you. Also, never be afraid to email us follow-up questions after your interview. I forgot to ask you, but I was curious, could you share? So yeah, and never be afraid to take a break too. If we ask you a question you're not quite sure how to answer, always have a prop with you and just, you know, and then you can talk. Sometimes that's helpful too.
That's great. Honestly, I feel like I do that subconsciously, but now I'm going to do it even more like consciously about it because that is a great tip. Yeah, just take a second and breathe. I have been on the other end of it interviewing for school, and I think you kind of know within the first couple minutes, do you even like, are the people who are interviewing you, are they giving good vibes? Do you feel supported? Do you feel like this is a good environment? Luckily, I had that immediately. I think, you know, our professors are so good at showing that. But we have another question about what should we be asking the interviewer, school students? So I don't know how to add that on there, but I would say, just from my perspective, something that I asked is how do the professors support the student? So what is the like policy on questions, help outside of class? That's always a good one. And then always ask about, personally, what I've noticed now being in the program is about research. If you have any interest in research, ask about it. Even if you don't, that might be a deciding factor for a school. But that's another question that you can ask that would make it look like you've done a little bit more research. What do you have to say?
Those are really good, Rainy. You can also ask questions related to research, entrepreneurial opportunities, population health, program development. Not everybody is interested in research, and if that's you, that's great. If it's not, there might be other unique opportunities to learn more. Program development, especially in entry-level OTDs, is a little bit more prominent, but it's very much embedded into our master's program. But ask about it. You can also ask about, specialties. Another really good question to ask too is, for the faculty who are teaching their courses, are they experts? Are there specialties in the courses they're teaching? You want to make sure that you are learning from people who are experts in their field, because they are going to be able to teach, I believe, more effectively, because they're going to be incorporating knowledge from clinical practice. It's going to feel very different. It's going to feel very relevant. They're going to have more connections in the community of people who might come in who have very subspecialties, but that's sometimes a rarer thing to find and a really good question to ask.
Yeah, I think personally at Midwestern, what I kind of fell in love with the faculty is that we have somebody from just about every setting, at least at one point in their career. And then if we don't, they know enough people because they've been in the field that they're able to pull those in for us to learn from, which has been so helpful. So just being exposed to different aspects of OT and the kinds of settings that you can go into has been a game changer for me. You know, most students when you come in don't know what OT maybe even is, or the extent of where our scope of practice is. So asking these questions about guest lecturers or the specialties is a big one. But also just a note, make sure that you don't go in too set on a specialty. So if you believe that you're going to be a hand therapist, that's amazing, and you might be, but make sure that you have opportunities to be exposed to other areas of practice, because you might find something completely different that you love. Mm-hmm. What are some of the settings that faculty specialize in here?
So we have certified hand therapist, mental health. We have acute care ICU specialist, a gerontologist. Actually, we have two of them. AT, so assistive technology. We have a transition specialist, so for young adults who have developmental disabilities and they're transitioning out of school into whether it's post-secondary education or into work life. We have school-based a couple school-based therapists. We have multiple faculty members who have either owned their own businesses or have been directors and managers at clinics. So we have that specialty embedded into our program. And we also have a faculty member who specializes in neuro, but recently also became a marriage and family therapist, which that's been so great and so much fun. Professor Tully is incredible, and we do a lot of collaboration together, but also getting that perspective of someone who's also a mental health therapist, not a mental health OT, and kind of where our scope of practice differs and then how we align and can support each other has been wonderful. And she's also the one who specializes in neuro. And oh my gosh, I think I got everybody. So we have pretty much almost every specialty. We don't have someone who specializes in pelvic floor. We do have someone who specializes in aging. However, we have close relationships with a couple of therapists in the community who come in and help with that content. We have a lot of pelvic floor content that we've embedded into our program. And then population health, that is more or less an area of specialty for me as well. That was my doctorate, emphasized population health. So I teach the program development course in conjunction with population health. Are there scholarships for the program? Yes, we do have scholarships available for our program.
Going back to the specialties, I think I believe Miss Cindy Salem, she is early intervention.
Yeah, she's also done early intervention, correct. And she has an emphasis in disability studies. So we also have that perspective as well, which is phenomenal. So we have a really well-rounded faculty, which makes it really fun to collaborate together. We are not competitive at all. somebody starts a research study and it's like, okay, I think you can fit. Or, even Dr. Trujillo found a grant recently and pulled a couple of us in and like, can you help with this? Which is just, it's the best environment. It's just warm and collaborative and very nurturing.
Yeah. We also have a clinic on campus. So the Midwestern Multi-Specialty Clinic. Our therapy unit, we have a sensory integration peds clinic. Miss Mickey is fabulous. So she's awesome. We get to see her a couple times throughout the year in classes, and it's a fieldwork opportunity for some students. And then we also have Mr. Charlie, who is, I think it's his first year still, or he just finished his first year, a neuro outpatient clinic.
Yeah.
So that is really awesome to have on campus to go and visit, to see, but also to get their expertise and in the classroom.
And another thing, we also recently, Dr. Katina Brown has retired. She's a professor emeritus with us, but she's written the mental health textbook. She's written the research textbook, and she's now also an editor for Willard and Spackman, which is like the main textbook for occupational therapy. So myself and then Professor De La Montagne were directly mentored by her as well. So we feel very lucky, very, very lucky to have her. And she often will come back and also help mentor research groups as well. So, I mean, she is the expert of all experts.
Yeah, I know I've mentioned research, but I think Midwestern program, we are a master's program. So unlike a traditional doctorate OT program, and correct me if I'm wrong on anything, but they do a capstone. They do a capstone research project at the end of their program. We don't have that, but we do a systematic review research paper.
Yes.
So it's really interesting to be able to do research, not to the extent of the capstone, but to be involved in it, because our program here is so adamant about being evidence-based and making sure that your interventions are backed by science. So if a client or family asks a question or questions it, you're able to back it up with the research. And so it's been such a unique experience to be on the other end of the research. And I think it just makes the program just a little bit more special and us feel just a little bit more prepared going out into the field, because when you have to spend 6 months researching a topic, you feel like you have some knowledge behind it.
So true, Raini.
And yeah, and like you said, we have a bunch of professors here that have written textbooks, very famous people in the OT world. I feel like anywhere I go, they ask if somebody so-and-so is here or how they're doing. So it's been really awesome to be a part of that. The last thing, unless we get any more questions, that I wanted to mention is how you're an alumni and now you teach here. Yeah. I think it's amazing that we have professors that have gone through the program, loved it so much, they came back to teach us. But also to have like that relationship as a student professor, and then to one day maybe be colleagues in a sense.
Yeah.
But yeah, if you had anything to say on that.
One of those things where, we are professors for a period of time with our students. We do not think that we are better than our students. We try to limit that power dynamic as much as possible. Obviously there is a power dynamic. If I said there wasn't, that would be ridiculous. But, our students, you will be our colleagues soon. And we respect you as people. We respect you as future clinicians. And that's, I think, one of the best parts about Midwestern is our culture is very different as a university compared to some others. We are fully available for our students. We are there. We recognize that our students are people first, and that life happens when you're in grad school. And we've had students who've experienced tragedy during grad school, and we have amazing counseling support services on campus, but we are also there as academic mentors as well during hard times. But it's a really amazing place to be. It's such a unique place. You feel like you can learn with ease. You feel supported. Obviously, if I didn't feel that way, I wouldn't have come back. But also, fun fact, Charlie and Nikki, who are in the clinic, they are also from my cohort, my graduating cohort. And they've also come back. So it's been really fun having them there. And seeing how far we've come and different areas of specialty we've chosen and how we've continuously been so supported by Midwestern. Once you're a student at Midwestern, you are forever kind of a part of this amazing community where that support never goes away.
Yeah, I would say maybe 80 to 85% of all of our guest lecturers have also been Midwestern alumni.
You've just been around for such a long time that a lot of grads out there are Midwestern grads. Granted, there are more programs now, but it's true. And they just are doing amazing things. They have this confidence to pursue their dreams and their goals, which I think is amazing.
Yeah. And I think that really is quite specific to Midwestern and the culture and the relationship that students have with each other and with the faculty and how the faculty work together. It really is just so harmonious. And then that transition into practicing from being a student is more seamless than it could be had the culture not been so supportive. Absolutely. Yeah. Well, thank you so much for your time. Was there anything that we missed?
I think that's it, Raini. And thank you for your time too. This was fun.
Course. I know. I love getting to talk to you, and I'm so glad I got to ask some questions and get to know more. There is a post. I don't know how to post. Oh, there we go. You can hear more from Dr. Anderson on her TikTok and Instagram. And you should definitely check it out. Yeah.
Sounds great. Well,
definitely check it out. Of course. Thank you so much. And I hope you guys listening in enjoyed it. And thank you so much. Have a good one.